Okay. So those would be the prototypical. On a quiz or test, someone might ask you, well, where are common locations for dense regular connective tissue? Well, that's the answer. Tendons, ligaments, and aponeurosis. If you look at bring Slim in here. I think you guys remember Skinny. That was Slim's cousin. What do you think these are? Okay? These bands here. It's connecting one bone to another bone. Connecting the scapula here to the clavicle. Fibroblastical ligament. It's a ligament. It connects bone to bone. So that would be made up. When people have an ankle sprain, what's happening? They're tearing that ligament. Okay, they're pulling apart that ligament. Okay, they're stretching that dense regular connective tissue. All right. On the other hand, if we mention dense irregular connective tissue, dense irregular connective tissue is also composed of closely packed bundles of collagen fibers, but instead of having a parallel arrangement, there's a swirling irregular arrangement of the collagen bundles. Okay? So it exhibits an irregular swirling pattern. And that allows it to withstand stretch from all directions, not just along one plane, but from all directions. The major cell type, just as with dense regular connective tissue, is the fibroblast. Okay. And the prototypical location is the dermis of the skin, particularly the deeper layers of the dermis. Okay. It can also form the capsule of certain organs and joints. You can also find it deeper, what's called the deep fascia, the deep connective tissue in the body that surrounds muscle groups. But if we had to pick a prototypical location for dense irregular connective tissue, it would be the dermis, particularly the deeper layers of the dermis. It's called the reticular layer of the dermis. So in this case, these are fibroblasts, but the bundles of collagen are swirling and moving in different directions. So I'm going to give you, you've already looked at the epidermis of the skin. That's the keratinized stratified squamous layer. If you look deep to it, that's the dermis. So I'm going to give everyone a skin slide. I want you to find dense irregular connective tissue. I'll give you one order. Now I'm going to point out something very essential. If you look at this skin, this is epidermis up here. The superficial layer of the dermis, that's the layer beneath the epidermis. This area right here, it's called the capillary layer. That's made up of loose or irregular connective tissue. Look at the spaces, the thinness of the fibers. If you go deeper into the reticular layer, that's where we find this dense irregular connective tissue. Let's go higher power. So this tissue here, the superficial tissue of the dermis, represents loose connective tissue. Again, it's not stretched, so it doesn't look exactly like you saw earlier. Okay. But you can see that most of what you're looking at are collagen fibers, okay, but they're thinner, okay, and there's lots of space. If we go deeper, the bundles of collagen get thicker, they're more closely packed. This is characteristic of dense, irregular connective tissue. And these are fibroblasts. Sometimes you see the fibroblast on end, meaning they're coming out at you as opposed to lying longitudinally. So again, you can see the swirling nature of the fibers. Some of the fibers are moving in this direction. Some of these fibers are coming out at you, so this is cut in cross-section. Some of the fibers are cut obliquely, like this one. Some of them are cut longitudinally, like these. So that's irregular, and it merges up higher with loose connective tissue over here. And by the way, if you look at this loose connective tissue, that would be a classic fibroblast right there. A nice fibroblast. And that's a fibroblast also, that's a fibroblast. Most of these cells are fibroblasts. Now, this right here is going to be a plasma cell. You see how the nucleus is pushed off to one side? Okay? Now, you don't see the nice light staining off or the darker staining area of ribosomes, but the shape of the cell and the fact that the nucleus is eccentric, off to one side, tells me that's a plasma cell. This is a little blood vessel, capillary. There's the endothelial cell that lines it. Okay. This is all within loose connective tissue. Oh, there's another plasma cell right here. There's the nucleus, there's the lysosome right here. So this is a plasma cell. Now some of these big cells, like this is a big cell here, that's going to be a macrophage. But this is a great example of loose connective tissue. Again, this is the papillary layer of the dermis. Deeper within the dermis is the prototypical location of dense, irregular connective tissue. Talk about dense regular and dense irregular. Elastic connective tissue is sometimes referred to as elastic dense regular connective tissue. Okay? So it can be a look-alike to dense regular connective tissue. Okay? You have elastic fibers, okay? And elastic fibers tend to be more, I'm going to call them teased, more curvilinear, more refractile. And they're sandwiched between bundles of collagen fibers and fibroblasts. Now, this is best seen on a slide, okay? But we're going to show you a couple of images here. Remember that elastic fibers in general are called yellow fibers, okay? And so they impart kind of a yellowish tinge to tissue. There is a yellow ligament, which is a band of elastic tissue that runs along the vertebral column, okay, along the dorsal aspect of the body. That's called the yellow ligament because it's full of elastic fibers. The walls of some of the larger arteries, like the aorta, have sheets, lamina of elastic tissue, elastic lamina. This is about the best I have here, but the slide's going to be better. Where These fibers here are elastic fibers. You see how they're a little more fractile and they curl? And then they're sandwiched between collagen fibers. Now what you'll find with elastic dense regular connective tissue or elastic connective tissue is that the fibroblasts do not line up. They're more haphazard. I'm going to see if I have a box of elastic connective tissue. Yes. This is best seen under the microscope. Everyone's got one? All right. Now on your own, see if you can differentiate elastic fibers from collagen fibers. Okay, I'm going to have you look up here for just a minute. This is elastic connective tissue on the projection scope. These dark homogeneous bands here, these are collagen bundles of collagen fibers. These fibers here that are a little bit more, what I call teased, they curl more, they're lighter staining. These are elastic fibers. These elastic fibers tend to reflect light a little bit more, they're more refractile. If I move the condenser down, you should be able to see them a little better. They become a little bit more prominent. Okay, so this is with the condenser down, and you can see the fibers kind of sandwiched between. Now, let's also look at the fibroblast. Here's a fibroblast, here's a fibroblast, here's a fibroblast. They're not lining up like you saw in dense regular connective tissue. So one of the points to differentiate dense regular from elastic connective tissue is the fibers don't line up. They're more, the fibroblasts don't line up. I said fibers, I meant fibroblasts. The cells. They're more haphazard. So in this particular stain, it looks like the elastic fibers are a little bit lighter staining, more fractile. I'm going to look at a different section of elastic tissue made by a different manufacturer. It turns out, does this look like elastic connective tissue? What kind of tissue is this? Yeah, that's regular. That's not elastic. It was in the elastic box section. Just goes a little bit better. Slides I really don't like. I'm just looking at this for the first time here. We'll use this one. Okay, they use an unusual stain here. And the elastic fibers are picking up more of a bluish tint. You see the elastic fibers in this one? Whereas these dark, dense, homogeneous fibers are collagen. The elastic fibers are picking up this blue stain. So this is not a typical HD stain. So look at your own slides, make sure you can differentiate elastic from dense regular. We'll look at one more thing. This is the wall. This is actually the side of the heart. This is one of the large vessels that are coming off the heart. Condense it down a little bit. And change the setting of the diaphragm. You see these retractile bands here are sheets. These are elastic lamina. So instead of simply holding fibers, you see sheets of elastic tissue within a wall of this artery. So the largest arteries that come off the heart are called elastic arteries because they have these sheets of elastic fibers. It's a type of elastic tissue as well. In fact, if you remember that all vessels, all arteries have an internal elastic membrane that's also an elastic lamina. All right. Did everybody differentiate the elastic fibers from the collagen? Now we're going to go to reticular connective tissue. Remember, to see reticular connective tissue, we have to use a special stain. Okay? Reticular connective tissue forms a three-dimensional web, okay, or meshwork, okay, like a spider web, composed of slender, branching reticular fibers that make up the stroma of the bone marrow and lymphoid organs. Lymphoid organs are made up primarily of lymphocytes. They're part of our immune system. Okay. Now, the fibroblasts that line reticular fibers are called reticular cells. So what you see when you look at reticular connective tissue, is you typically see these are usually going to be darker or bluish staining fibers that are running through the tissue like this, forming kind of a meshwork. And then you'll see modified fibroblasts called reticular cells that are sitting on top and lining the fibers like this. And because this reticular connective tissue forms the stroma for lymphoid organs, many of the organs, like lymph nodes, that have this type of stroma, you're going to have lots of lymphocytes. And the lymphocytes are either sitting on fibers or passing through the channels that are located between the fibers. So it says this type of tissue is associated with specialized fibroblasts called reticular cells that partially cover the reticular fibers with cytoplasmic processes. So it creates cell-line spaces, spaces through which lymphocytes and other cells can percolate. In addition to lymphocytes, you might see macrophages and plasma cells because this is immune tissue. So this is kind of the framework of stroma, reticular connective tissue, with these dark fibers, and then these wider cells, these larger cells are reticular cells. These are those spaces or channels through which lymphocytes and other immune cells percolate. Okay? So here, you see the fibers, and these are reticular cells. Okay? Here's the nucleus of a reticular cell here. These other round nuclei that look like dots, those are lymphocytes. Here's reticular connective tissue. In this case, the reticular fibers are staining black. These little dots, by the way, are mostly lymphocytes. Again, you can tell this isn't an H&E stain. This is a type of silver stain. Let's see if we have some reticular tissue to show. Now, to see the reticular fibers, you have to move to an area of the slide where the lymphocytes are not as dense. Because the lymphocytes are sitting on that connective tissue and covering it up. So this is a section of a lymph node using a silver stain that's picked up by these reticular fibers, they're gyrophilic. And so you can see kind of they're branching and moving throughout the tissue. Now, these cells that are very round, and they have nice round nuclei, these are mostly lymphocytes. If you go to an area of the slide where the lymphocytes are denser, then it's not as easy to recognize that underlying stroma. Think of the reticular connective tissue as the mattress upon which all of these lymphocytes are sitting. Get a different silver stain. And by the way, when you see a vivid stain like this here, it's not H&E, you know, why are they staining this tissue with this stain? Well, it's to demonstrate the reticular fibers. It's a different type of silver stain. Again, it's a lymph node. Higher power. Again, when you see a slide like this where everything is staining now black in this one, well, it's to demonstrate those reticular fibers. That they kind of form a meshwork or three-dimensional web. Let's go back to the other one for 1 second. Some of these cells, like this one right here, instead of being nice and round, it's more oblong, and it's sitting right on top of this fiber. This would be a reticular cell. Okay? On the other hand, when you see cells that are perfectly round, like dots, okay, like this one right here, and this one right here, that's going to be a lymphocyte. The reticular cells are going to be more oblong and tend to sit on fibers. And if I give you an example, like this is a reticular cell here, it's a little bit larger, it's a little bit more long. You see it mostly in nucleus, but you see also the nucleus is not as dense. It's very light staining, but it's sitting right on top of the fiber. Those are going to be reticular cells, whereas that right there is going to be a lymphocyte. And if we look closely, we can find plasma cells and we can find macrophages in this lymphatic tissue. These are right here. Here, here. Let's look at this one here. What do you think that is? This is actually a small blood vessel arteriole. Now, this stain is not meant to demonstrate blood vessels very well. This stain is meant to demonstrate those reticular fibers, but if you look closely, that's an endothelial cell. nucleus of endothelial cell. There's probably a nucleus of endothelial cell right here. Okay? This layer right here is smooth muscle. And notice what's called the tunic external, the outer lining of this arteriole. It's got reticular fibers in it. Organs that have reticular and connective tissue tend to be stretchable. Just like lymph nodes get bigger, they enlarge in response to infection. Okay? Well, blood vessel walls have to be able to expand and contract. And sometimes you see reticular fibers within that type of tissue where they have to undergo change in size or form. The last type of tissue we're going to talk about is, and this is the last type of connective tissue proper, is adipose tissue. This is different from other types of connective tissue in that there's relatively little extracellular matrix. It's very cellular. And so that's an exception to the rule for connective tissue. Except that with connective tissue, cells are scattered wide apart. You see mostly extracellular matrix. Not in the case of adipose. The cell type is called the adipocyte, or fat cell. The main purpose of the cell is to store fat, or triglycerides. In fact, what happens with adipose tissue, or adipocytes, is you see these cells kind of closely huddled together, and they're all filling up with fat. And as the fat fills up the cell, like this, the nucleus is pushed to the very edge. So oftentimes if you see a nucleus, it's being compressed to the side or to the cell membrane, and the rest of the cell is filled with fat. Now, during tissue preparation, the fat actually dissolves out. So what you're seeing is a big space where the fat used to be. Adipose tissue provides thermal insulation. For instance, we have a layer of adipose tissue just beneath the skin. It's called the subcutaneous layer, or the hypodermis. And it protects against heat loss. It also supports and protects organs. So we have a layer of fat around our kidneys. We have fat around our eyeballs within the organ, where it serves for protection. If you had to pick a prototypical location, it would be the hypodermis, or this is the subcutaneous layer beneath the skin. I said it's around the kidneys and eyeballs.